Thank you for listening to Fem Talk 89 FM, and we welcome viewers on my TV as you tune into Femling Pacific's Radio with Pictures. Coming to you live from the historical Morrissey Memorial Church, or as we all know it as the Dilkusha Church.
It's all part of our 10th anniversary celebration. FemTalk 89 FM was launched on May 5th, 2004, and our very first broadcast was on May 25th, 2004 as part of the commemoration of the International Women's Day for Peace and Disarmament.
Last week, we were in Nandi with Idaho, and today our theme is communicating peace and development. So let's join Sharon to introduce the members of the Femling Pacific's 1325 network members in Nausori.
Thank you, Jasmine Embolo, and welcome back to the Dilkusha Church as we bring you Radio with Pictures on FemTalk 89 FM and simulcast on my TV. From maternal health to pediatrics to the health needs of the elderly, persons with disabilities. If you think about it, throughout a woman's life cycle, she's probably the one that needs to have health services at her fingertips, accessible and affordable. The National Women's Plan of Action prioritizes health as part of the access to services priority, but how well is this reflected in the daily lives of women? Throughout this week, ahead of the broadcast, we've been speaking to 30 rural women leaders, representing another 800 women from Tailevu, Rewa, and Nausori. And so we're going to discuss health security now with Manjula Devi of the Korodiri Mothers Club. Hello, Manjula. Hello. We have Naomi Kasai Naseva. Naomi is a member of the Tailevu South People's Disability Network. How are you today? Good. And we have Uttra Prasad, a member of the Rewa Sanatanari Sabha.
Yeah.
How are you today?
I'm good too.
Okay, and we have Anna Prasad, a member of the Grace AOG group. Hi, Anna.
Good morning, Sharon.
Good. Okay, what are our health priorities? Anna, I'm going to come to you because you were the one who really got my attention the other day when you said, you know, we go to the hospital, we sit and we wait, and then we just go home with Panadol. So you're a mum. What's the kind of health service you feel you need for your family and for your community?
For me as a mother, I've got 4 kids. So the service I would like is one that I don't have to dig into my pocket for taking out money to buy for medicines when they are not available at the pharmacy. And at the moment, I believe that $11 per patient is the grant that's been given. And from my point of view, I think that more grants should be given, especially for us patients that you have more people to look after in your family.
Yes, so we actually need to have an increase in the national budget. So if you're talking about getting more than Panadol at the end of the day, you want to see medicine actually available at your local hospital.
Hospitals, yeah.
The subdivisional hospital here caters for a huge population.
Yeah.
Rewa, Tailevu, people come from Nausori, there are people coming, you know, like from the Waimbakasi area, even sometimes from as far as Nitsinu. What do you think needs to be done? There's a new hospital being built in Navua. Does Nausori need the same?
Of course, we definitely need to extend the Nausori Health Center because from my own experience, when I come to the hospital, I don't get number. So from here, I have to pay fare to go to Waimbakasi Hospital in order to be seen by a doctor. Because if we'll wait here, we will receive the number at 2 o'clock.
Yes, okay. Manjula, I'm just wondering, how far do you have to travel to get health services? Last week in Nandi, people were talking about having to catch the 6 o'clock bus to get into the hospital, you know, really early in the morning. This is the Nandi District Hospital, to get one ticket and then hopefully be seen, you know, before lunchtime. How far do you have to travel to get health services?
I have to travel by 6 bus also if I want to get a good number. And then if I want to get a good number, then I have to travel by the 6 bus. And if takes us about, my house is 4 kilometers away from Nausori town, so it takes time to come.
What does that mean, getting up at 6:30 in the morning, particularly if you're bringing a sick person?
Yeah, still if you are bringing a sick patient to the hospital, you have to have a number before they want to check. Right?
So would you, if like you had a sick child, does that mean that you would have to get up at 6:30 together with the child and bring them to sit at the hospital
Yes, yes,
from 6:30 in the morning?
yeah.
I know my late nanny complained once many years ago about the same, and that she was having to sit up at the Lambasa hospital without having breakfast. How do you prepare for that, Utra? If you were to have to come to the hospital so early in the morning, what do you have to do?
We have to wake up about 5 o'clock and save our children and go to school and come to hospital before 6. We cannot come, then we cannot have the number. After that, you have wait for 2 o'clock for the number.
So what do you bring with you in your bag? If you know you're going to be waiting for 6 hours, do you have to bring food? What do you do?
We bring parcel for us, and after that we're gonna eat if the time is there.
Anna, why do you think there's such a long wait? Is it because they don't have enough medical professionals, the doctors?
Sometimes there are not enough doctors at the health center. So when an emergency case comes, the doctor has to leave the patients aside and the outpatients and go to attend the emergency cases first. That's what takes so long.
Yes, Utra, you agree, Utra? Is that something that you're worried that you don't have enough health services? Because the doctors are the ones that have to write the prescription, the nurses can't do that.
Yeah, I agree with Anna's answer, because every time we suffer from that thing.
Okay. Manju, are you involved in any community health programs?
Yeah, I am a president of Koretiri Maths Club, and recently I have also done this course, child protection, and I work in a community with my ladies, because in my community there is temple, there is school, and there are needy people. So in our club, what we do, we just that the source of income in a club is only to refer, and the amount we get it from there. Sometimes recently we were asked to help a poor lady, and we did so with the money. So I do some community work also.
Okay. And the kind of help you rally together, is that sometimes for medical assistance?
Yeah, I think we need some medical assistance in my club also, so that I can give to my community, the poor and needy people who are in need.
Okay, thank you so much, Manjula. Coming to you, Naomi, because the rights of women with disabilities and your needs specifically from a health perspective are probably different compared to us able-bodied women. What are you hearing from the Disability Network when it comes to health services?
For us, our disability, we have the rights. Like myself, when I go to town or in the public places, what the people think, I don't care. Because of my rights.
Okay, so you're talking about just getting out and about and accessing public places. What are the disabilities that your committee is addressing? Is it just physical disability, or do you have visual impairment? Are there people with hearing impairment?
Both.
Okay. Tell us about your members.
In our members, we only 10 members. Last year I joined the Televisal Disabled Organization. It's the first time I was joining that organization. Before I was staying home. When I was doing the organization, I was happy because that's a new thing I learned from there. I just go to the workshop for the training from last 3 months. I just go for the training for the sewing unit in Algeria. I see a lot of disability and I feel sorry for them. For myself, I was lucky that I have physical disability.
Okay. So if you were to go to the health center, how easy is it for you access-wise, like physical access-wise? Are the hospitals, is the health center disability friendly?
In Nausori, we have access in Nausori for the wheelchair and for the myself. I just use the stick to control myself or going to the health center.
Okay. All right. And what about access to medicines? Are there specific, like, do you have to go for physiotherapy? Is that available here? Or if you were to get any specialized treatment, where would you have to go?
I have to go to Suva for CWM for the special treatment
Okay.
for my myself, my leg.
And how much does that cost you?
It's too expensive. Maybe from before it was 3 years now. I just don't go for that treatment for my leg.
You haven't been going for your physiotherapy for the last 3 years because
It's too expensive.
you can't afford. What's expensive? Is it the transport or to pay for the?
To pay for that treatment.
Okay, all right. Thank you so much for sharing that with us, Naomi. So, ladies, we know what the problem is. Yeah. What are the changes? And we know obviously what the changes are. What are your recommendations if? With the national budget, you know, there's an annual budget every year dedicated to the health service. Anna, if somebody was to ask you, what are you recommending? What would be your key points?
I would like I said previously, more health centers and especially dispensaries in our community. At the moment, we don't have any in the Vusia corridor. And for all the dispensaries to have medicine, that's the most important fact. Because a lot of us, we'd rather spend money on our children's education or buying food for the families instead of coming to the health center. So having a dispensary in our community will help us to just go there and get checked up. And if doctors, once in a while, if they can visit those dispensaries, that will be good enough.
Well, you've talked about the family budgets, and we were discussing that in the last segment as well. How much do families have to budget for health services? You know, whether it's transportation, like you said, it's not free, is it? There's a cost. So, how are you managing? How do you organize in your family?
For my family, like I said previously, I've got 4 kids. So on Saturdays, if I want to take them to the health center, they will be getting an adult fare. It's not a child fare. So on top of that, if I reach the hospital, they don't have medication. I have to buy those medicines. So at least if I have $50 with me, that then I can provide a good.
Then you know I can take them to
the doctors. Yeah.
Do we know if families are giving up on health services? Are they not going to the doctors?
Yeah, sometimes they are, because when we go there, just like Anna has mentioned, we have the medicines are not there, and we have to buy it from the chemist. And what about the poor people who don't have enough money to buy? So I think.
From your clubs, what are the women saying about? Anna's mentioned $50. Is that what you have to think about?
Yeah.
And if the family doesn't have high level of employment or they're not earning, what are the alternatives then for people?
They have to do the budgeting for the family, just like they have to buy the groceries first for the children. Putting food on the table is the main priority for them. And then after that, what the extra money they have to use it in their medical or something like that.
Non-communicable diseases, NCDs, is on the rise. There's a lot of awareness raising now around eating healthy food, nutritious food, eating the right kind of food. But as we were discussing in the last segment, when you can't afford to buy the right type of dal, for example, then all you're doing is doing your split peas dal, right? Rather than the mixture that's nutrition. Are you seeing the connection between this kind of inability to purchase the right type of food and NCDs? Is it only about people eating bad food, or is it that they just can't afford to eat well? Anna, what do you think? What are people giving up?
Like people, they are giving up on the vegetables that will keep them more healthy, Like, for example, a mom should rather buy a tin fish, and she's got some potatoes at home. She'll get a bigger pot out of that instead of going to buy a small bundle of cabbage, because cabbage won't feed the family. That's exactly what mothers are doing.
Yeah, it's honest to myself too. When I have to cook more, I have to buy a cheap thing for my children to survive them.
So what, for example, when you say cheap things, what does that mean? The cheaper product, which
Yeah.
may not be.
Yeah, it will be no expensive for me. It can afford my family little bit. This I can buy. Not in meat, I can buy tin mutton like that for my children. Yeah,
And that's obviously going to have
Yeah.
a bit more fat
yeah.
rather
For-
than
yeah.
the fresh meat.
Yeah, that gonna affect my children in the health.
How much would you be spending on food?
Might be $200 a week.
$200
Yeah, because
a week.
I've got 3 kids, big one, all big.
Yes,
Yeah, because they need more food.
they need more food.
Yeah.
And one of the women was saying, you know, we're talking about price of milk.
Yeah.
Are people cutting back on things like milk?
Yeah, nowadays the milk price is very high, and I have a grandson whom we paid the very uh, cheap milk,
The
just
cheapest.
just like cow milk, and now he's okay. He's doing well. So we have to do just like when you were talking about the dal, just like we ladies we have to mix all the dal and cook. And if there is only one dal, just like split piece, so we can make it nutritious by putting sage bhaji, carrot, and other stuffs in that, so that it can be made nutritious. Yeah.
So there's a real connection, isn't it, between health and what we can afford and put food on the table. What about you? What do you think? I mean, how are you, Naomi, organizing for your family?
I just put the vegetables in the root crop for my family.
And how many children do you have to look after?
Only two.
Only two.
Yes.
Okay, so they don't complain with the vegetables and the root crops. Okay, that's lucky then. So coming back to recommendations, what do we want to see? Anna?
Recommendations, I think so for my area, that's the most important thing that I would recommend is to have a dispensary in our community, and health workers. They are important too, because they are the one who will be giving care to those who need them.
We do have some community health workers, but I also know that they don't get paid to work. So would you like them to see, like, obviously,
Yeah.
set up the dispensary, give us reliable, well-trained health workers, and from time to time, get the doctors coming out to you.
Yeah, because like they are to be doing then what the nurses and doctors are doing in health centers and hospitals. So I think that they should be paid. Health workers, they should be paid.
Thank you, Anna. Uttara?
Yeah, my recommendation is that we need more doctors in the hospital to see the people, and should be more medicine in the hospital for all the people to share, and doctors and the numbers should be seen from the morning to the afternoon. Don't wait for 2 o'clock.
Okay, so have available medical professionals all the time, so people aren't coming at 6:30 in the morning and then waiting till 2 o'clock, because there's no point coming to
Yeah.
get your ticket at 2. You'll be seen tomorrow.
Yeah.
Or does the ticket system start again the next day?
They finishes. So they have to finish late, but they'll carry on.
Oh,
So,
okay, so they'll see people right till the end. Okay, so Nami, what's your recommendation? What would you like to see as far as disability rights and health security?
My recommendation for the disability, we should have a special doctor in hospital to make it easy for us. In
And-
the
yeah.
hospital, we have to take numbers. We can wait for a long time, long hours. Like myself, I just walk from home to the hospital, and then hospital from home.
Do you think people would be okay with that if, you know, people with disabilities come in and get treated quickly rather because of their disability? Think that's a good idea? Yeah? Okay. Manjula, what's your recommendation?
I think for me, the doctors should work 24/7. Because why I'm saying this is in on Sunday, actually on Sunday when we go, there is no doctor, and the nurses are supposed to see the patient, and we are told that give 2 tablets to drink, come Monday morning, then the doctor is going to see you. So I think we need more doctors in just like more doctors to see patients.
Because you can't really tell people don't get sick on the weekend, don't come to the hospital, right?
And imagine when they give you 2 tablets and they ask you to come in the morning, what about within that hours if the patient becomes very sick? And you don't know what will happen to him. Then if you go again there, then same nurse will see you again. So
And that's also because you're coming from a long distance.
yeah.
But maybe Anna's idea of having the community health support, the dispensary, the health worker organized there, then you would then understand why people wouldn't have to go.
Because even at night, even though if a doctor is on shift, will only be seen by a nurse, and doctors are there for emergency cases only. So you'll be given a few Panadols, and you'll be told to go home and come the next morning. That's the case, yeah.
Okay, so the need to obviously increase the health budget, but look at the kinds of service delivery, so access, the affordability issue, both at the central space or central part of the division, but also at the community level. Thanks so much for sharing your time with us and to discuss health security. I'd like to thank once again Manjula Devi of the Korodiri Mothers Club, Naomi Kasaina Seva. Thank you, Naomi, for joining us today. Uttara Prasad and Anna Prasad.
Thank you,
Thank you.
Thank you, Sharon.
Coming up after the break, our final segment.
Thank you, Sharon. And a reminder that if you are in Suva, you can tune in to Femtalk 89 FM Suva from 7 a.m. to 7 p.m. all weekend. And Femtalk 89 FM Lambasa can be heard from 10 a.m. to 2 p.m. on weekdays.
After the break, we continue with Fem Talk 89 FM's Radio with Pictures.